Congenital adrenal hyperplasia. Definition: congenital adrenal hyperplasia, abbreviated CAH, is a disorder that affects the adrenal glands. These glands produce adrenal hormones such as cortisol, aldosterone, and even sex hormones. A person with CAH does not produce enough of the hormones cortisol and aldosterone, and produce too much androgen, an hormone that gives male characteristics. This is a video about what is congenital adrenal hyperplasia.
Alright, so you're wearing a pretty necklace, and you take a little pill 3 times a day. But why do you actually do that? You have to do this because your adrenal glands are sick. Your adrenal glands are inside your body. Look, there they are. Usually, they make very important things for your body that give you energy. But because your adrenal glands are sick, you don't make any of those important things anymore. That's why we put those important things into a little pill, so you get all the energy you need to go out and play. But sometimes, something really exciting happens, and you get butterflies in your stomach. You know, your birthday is coming up, you're going on a holiday, or maybe you have a fever. Then your body needs a lot more energy, and you have to take extra pills. Because if you don't, you get nauseous, dizzy, and you could get very sick. And you don't want that, of course. And your necklace, you always have to wear it, so that everyone knows your adrenal glands are sick. And if something goes wrong when your mummy and daddy aren't around, other people also know that you need more of those little pills.
Application in medicine. It is the most common adrenal disorder in children. The result of this enzyme's deficiency is the decreased production of cortisol, which increases secretion corticotropic hormone by a mechanism 1-3 negative feedback. ACTH excess stimulates the adrenal cortex, causing hyperplasia and overproduction of cortisol esteroid. By enzymatic defects and overproduction, other adrenal steroids, which are synthesized independently, deficiency 1-3 enzyme activity. The pathophysiology of genital adrenal hyperplasia starts from early fetal life and gives a result adrenocortical hyperplasia. It is a disease that should be suspected and investigated in every child is born with sexual ambiguity. Another video about easy congenital adrenal hyperplasia mnemonic.
So that will actually help you answer. I just wanted to let you know a very good mnemonic for congenital adrenal hyperplasia. So basically we know that there are 3 main enzymes that USMLE might ask you: 21 hydroxylase, 17 alpha hydroxylase, or 11 beta hydroxylase deficiencies, right? So to answer the questions, just remember this, that if you write for aldosterone and T for testosterone, just write down the numbers like 21, 17, and 11. And the trick is that whichever letter has 1 underneath increases. So 21 will have increased testosterone and lower aldosterone. 17 will have higher aldosterone and lower testosterone. And 11 will have both of them high.
The process of this disease is that people with this disorder must take medication for life and generally good health. However, they may be lower than normal adults even with treatment. Congenital adrenal hyperplasia usually does not affect fertility. The cons include that the baby with self-esteem CAH usually shows some of the following characteristics during the first week of life: bad nutrition, lightness and drowsiness, vomiting, diarrhea, dehydration, weight loss, low blood pressure, low amount of salt in the blood, too much acid in the blood. This is called metabolic acidosis. Girls who go untreated may develop other male characteristics and behaviors as they grow. Some of these changes include deep and hoarse voice, excess hair on the face and the body, missed menstrual periods or irregular periods or limited. Corresponding to early puberty is armpit hair and pubic area changes, etc. The treatment of congenital adrenal hyperplasia includes cortisone medication, surgery for girls with classic CAH, treatment to prevent short stature, treatment for precocious puberty, additional treatment for classic CAH, treatment for non-classical CAH. Neonatal screening is a medical study that will at first diagnose and appropriately treat for diseases. The issued applet in Ecuador. Neonatal screening is a medical study that will at first diagnose and appropriately treat for diseases: congenital hypothyroidism, penetoluria, galactosemia, and congenital adrenal hyperplasia, which causes mental retardation. Provide medical screening testing for all children as born in the country, becoming a major change for public health. As in Ecuador, averaged 315,985 births a year is recorded. The program aims to charge 15% of children as born in the country in the first year of implementation. The study must be conducted on all newborns the fourth day of life. The test is effected through taking a blood sample obtained at the right health of children. Once the sample taken is sent to a specialized laboratory program. Finally, the conclusion is the congenital adrenal hyperplasia should be ruled out in even newborn with sexual ambiguity. Ideally, this pathology is to be taken into account in the assessment preconception that diagnosis is made at the level prenatal pregnancy in early times for proper treatment and avoid all the complications that this disease brings. It must also be taken into account in adulthood as a differential diagnosis as a cause of hyperandrogenism and anovulation with consequent infertility. Finally, the video about training congenital adrenal hyperplasia.
With blood and with sympathetic nerve endings.
I'm going to talk about congenital adrenal hyperplasia. Sounds like a pretty complicated disease process, so let's just break it on down. Congenital. Congenital means existing at or dating from birth. Congenital adrenal hyperplasia is a recessive genetic disorder. It requires a copy of a specific mutation in both the mother and father.
That is all. Thank you for your attention.